Hi, I'm Cheryl Chapman, and I would like to discuss my support for integration of comprehensive mental health and general health care. Treating the whole person through the integration of mental and general health care will save lives, reduce negative health outcomes, facilitate quality care, and result in long term cost savings. Proper mental health care plays an important role in one's overall health. From the early centuries, mental illness has always carried a negative stigma. These negative stigmas persisted to the early 1900s. In 1840, Dorothea Dix lobbied for better living conditions after witnessing unhealthy and dangerous conditions in which many mental ill patients lived in. In the time spans of about 40 years, she successfully persuaded the U.S. government to fund the building of 32 state psychiatric hospitals. After implementation of the facilities, they faced major hurdles such as understaffing, underfunding, and inadequately trained personnel. These shortcomings led to an increase in poor living conditions and human rights violation. And after much scrutiny, a push for deinstitutionalization began. Many believed that the chronically and severely mental ill patients would thrive better in their communities. By the mid 1950s, deinstitutionalization began, as well as outpatient treatment in the communities. This also was facilitated by the development of several antipsychotic drugs. The closure of the state psychiatric hospitals in the United States was organized by the Community Mental Health Centers Act of 1963, and strict standards were placed on who was able to be hospitalized. It stated that only individuals who posed an imminent threat to themselves or someone else could be committed to state psychiatric hospitals. By the mid 1960s in the U.S., many severely mental ill people had been moved from psychiatric institutions to local mental health homes or similar communities. Communities began witnessing a flood of mentally ill individuals moving into the mental health homes or similar facilities. Many of the chronically and severely mentally ill ended up homeless due to need and the lack of a more structured managed care. Fast forward to about 2010, as it relates to the before mentioned issues, not much have changed. Treatment and care for the mentally ill continue to be low on the priority list in the United States. Mental health care continues to see cuts in fundings as well as shortage of professional mental health providers. What's even more alarming is the correlation of mental health illness and overall physical statuses of these individuals. For example, poor mental health correlates to increased risk factor for chronic physical conditions such as diabetes and hypertension. The CDC also points to a correlation between mental health conditions and health risk behaviors such as physical inactivity and smoking. There is also a growing body of research demonstrating the alarming high rates of overall health problems and premature death among individuals with serious mental illnesses. In fact, people with mental health conditions currently die 25 years earlier than other Americans. The direct cost of treating and supporting mental illness is approximately $55 billion a year. About $70 billion is the estimated cost of untreated mental illness, which is actually more than the direct cost of treating the mental illness. This includes the added cost of emergency room visits. Many individuals with untreated mental illness tend to use emergency rooms on a regular basis to deal with medical crises. This also leads to increase in congestion in emergency departments and increased need for greater staffing, which is another increase in cost. Mental health care is vital to the individual, our community, society, as well as our economy. This is my call to solicit support for increased funding for mental health care and the integration of mental health care with the general health care. Thank you.